Hi, this is Dr. Bob Dannenhoffer, Public Health Officer for Douglas County. It is March the 30th, and we're doing another of our Facebook Live events. We did a taped Facebook Live event on Friday, and we had a little kerfuffle, but the show was pretty good, so if you want to go back and look at it, please do. We did two longer riffs that time, one on all of the different treatments for COVID, if you're interested, and another one on what I would do if they put me in charge, which is so unlikely to happen that you may not decide you want to do it. Anyway, as always, we'll do our Facebook questions at douglaspublichealthnetwork.org. So people who put Facebook questions at Facebook questions at douglaspublichealthnetwork.org. We already got a few of those, and then we'll take live questions. But as always, we start at the top and then move our way down into what's happening in the world. Well, sadly, what's happening in the world is that we're clearly seeing an increase in the number of cases. This is very worrisome. In the rest of the world, they're calling it the third wave. In the U.S., it's calling it the fourth wave. But basically, throughout the world, we had a big peak around the new year, and then it came down different places, different times. But generally, in February, it came down. And now, in the rest of the world and in the U.S., we're seeing an increased number of cases. And the increased number of cases throughout the world is worrisome because the rise is steep and it's happening in so many places. So much of Europe is seeing an increase in cases, including the usual places we've talked about, Italy, France, and Sweden, as well as lots of other smaller countries, the Czech Republic and Poland. We're seeing South America really blow up. Brazil is having its largest number of cases ever. Uruguay, Chile, Peru, all of those places are really having quite a problem. And the Middle East is now expanding outward. Started in Israel and now expanding outward to areas there. In Africa, we're seeing some increase in cases. And in India, which had a little spurt last year, we're now starting to see an increase in India. And India, being such a populous country, it only takes a few cases per 100,000 to really be lots of cases. In fact, when I looked around yesterday, the only two places in the world that I could see that it was having a decreasing number of cases over the last 2 weeks was Iran and Mexico. Every other place I looked at was having an increase in cases. And again, you don't hear much about Africa, but I'll talk about it because Africa, for me, is a big concern. Again, they've had not very much disease. They've had no vaccine. And the concern is if this now starts to spread in Africa, they'll start already with variants and then move to more and more and more variants. And that really is a big concern because many of the new variants are more resistant to the vaccine, more resistant to antibodies, more resistant to previous infection, and that would be a real concern. In the U.S., we're at 30 million cases, 548,000 deaths. Cases are clearly up. Deaths are still flat or down, but cases are up, and now hospitalizations are going to go up. So there's a lot of noise in the death counts. They get counted later. There's always some controversy about which deaths you should count. And cases are problematic because cases are reflective of how much testing you're doing. So I put a grain of salt with cases and a grain of salt with deaths. Hospitalizations are the thing you can really trust because you don't get hospitalized unless you're fairly seriously ill with COVID, and they report these every day. So the data on hospitalizations is really quite smooth, and now hospitalizations are starting to go up. That is a big concern. In the U.S., we're seeing lots of disease in weird places. Southern Utah, northeast Missouri, almost all of Michigan, much of Minnesota, the entire New York, New Jersey area, and the Texas Panhandle. So really disparate places in terms of how much population and population density, yet you see on this heat map that they're really quite hot, and the worry is that each of our previous surges happened like that, where there were funny places that had disease, and then it just spread out. So early on, it was places in Seattle, and then in the second wave, it was other places that did it. So the real worry is that we're in for another surge. How big is the surge going to be? I can't really tell you. But the worry is that we're seeing more and more variants, and the variants are much more contagious, and that's a big concern. So, for example, last time I looked, the the British variant or the UK variant was doubling in proportions every 2 weeks. That's a big concern. Oregon's quiet. It's one of the lowest death rates in the country, one of the lowest case counts in the country, and it's quiet. The only areas in Oregon where you're starting to see some cases is in this little southern area. So Coos, Curry, Josephine, Jackson, Klamath, and Lake have had more than their share of cases. And again, we're not exactly sure what's going on there. We do not think actually that it's variants, but we don't know. Douglas County is quiet. We had 17 today, a little higher than I would have liked, but generally we've been averaging about 10 cases a day over the last 2 weeks. This allows us to stay in the high range and allows us to open some restaurants, bars, and gyms. A couple other things I want to say on testing. We've been doing for a whole year now, we've been doing testing at the fairgrounds. The good news is we have so many areas to do testing around in the community that the number of people coming into our testing event has dwindled. It's a good thing. That means that there's plenty of other testing around. Now, there was a question before, well, are the lower number of cases in Douglas County just because we're doing less testing? That could be an answer, but in that case, what you'd see is a lower number of cases, but an increased positivity rate. We have both a decreased number of cases and a decreased positivity rate, meaning that the decreased number of cases is not coming from a decreased amount of testing. So the testing we've done at the fairgrounds, we're going to retire that this week, and we're going to spend a lot of our time doing vaccinations, which is really, really the good news. So more vaccines are becoming available. Our allocation this week was a bit disappointing, but I think overall the amount of vaccines are up. We have 30 different clinics in the area that are giving vaccine. We have at least 15 pharmacies. It's going to be up to 18 next week. 3 EMS agencies. In addition, there have been a number of mass events. So this Saturday, we're doing an event at the fairgrounds. It's to give second doses of Pfizer vaccine to people who got the first dose on the 13th. So there's a question here. Sasha says, I'm super excited to get my second dose this weekend. As I was one who received an extra dose on the 13th, do I need to sign up again or just come back? And the answer is just come back. So if you had a scheduled appointment the last time at, say, 10:30, come back at 10:30. If you had an unscheduled appointment and got extra vaccine, come back at 2. And you don't need to do anything to confirm it. You can certainly confirm it if you want, but there's nothing you need to do. And then just come back and we'll get your vaccine. We had 200 doses of J&J vaccine. They're already taken, but we have lots of Pfizer vaccine and excellent vaccine that are available. So when I checked right before I went, there's 300 open slots. So if you're eligible, and right now eligible people 45 to 64 with underlying conditions, people work in food service, people who are wildfire displaced people. But you know what? Right now, we should just get everybody get vaccine. There's no way for us to check on the underlying conditions when somebody comes there. So if they say they're 45 and there's no way for me to check if they've got underlying conditions. So really, if 45 to 64 this weekend, we just want to use up all those vaccines. It would be a shame to have those vaccines and not do it. But before then, on this Thursday, the 1st, there's going to be an event up in Drain. So at the Drain Civic Center, Aviva's going to lead that. It's going to go from 8 to 11:30 and then 1 o'clock thereafter. To sign up for that one, you call 541-672-9596. They'll get you scheduled. Still not sure which vaccine they're going to use because the deliveries have been a little bit off this week, but they're going to certainly have one of the great vaccines for you on that event on the 1st. On our event on the 3rd, again, the J&J is already spoken for, but we're going to have lots of Pfizer vaccine, a great vaccine. So please, 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 we want people to come. We want people to get this vaccine as soon as possible because we think getting people vaccinated is really our way out of it. So Bob says, this is a different Bob, says, for recent cases and deaths, say in the last 30 days, are the people that are vaccinated getting sick or dying, or is there something else going on? So we are pulling those numbers, and overwhelmingly these are people who are unvaccinated. So what we did is we looked at people who were in 1A, healthcare workers and law enforcement, and in the 1B phase 1, which are the educators. And so all of those people were eligible for vaccine in January, and so by the 1st of March should have had their vaccine. And they should have had 2 doses of the vaccine, and they should have been fully vaccinated by March the 1st. So we looked at cases in March of people who were in those groups where they could have gotten vaccine, and we've had 36 cases of COVID in those. 34 of the 36, over 90%, are in unvaccinated people. Only 2 of the 36 cases were in people who were vaccinated. So what does that show us? The vaccine appears to be 90% at least effective. And we'll go on some other studies that suggest that it's not just us that has that, other people are seeing that, and that you should get vaccinated, right? So we could have, instead of those 36 cases in that group, we could have had just, if everybody had been vaccinated, maybe 4 cases in that group. So tremendous decrease in that. It also shows the vaccine is not perfect. So people who are feeling totally invincible after they get their vaccine, you should feel good, but not totally invincible. So this story that I'm vaccinated, I don't have to do anything, I can take my mask off, we can go back to old times, not exactly right, because there still is a small, much smaller than before, but it's still a small chance that you could get sick. So again, it appears that, or the majority getting sick or dying unvaccinated, it's not the majority, it's the overwhelming majority, well over 90%. So please, please, please get the vaccine. Jessica says, are there volunteers needed for Saturday's event? I think we have them taken care of for this week, but we're going to be asking people for volunteers for other events. So in addition to being able to get the vaccine at your doctor's office, at your pharmacy, at events like in the Drain Center, at events like our weekend event, at places from like EMS are going to do it. In addition, we've set up a Tiger team. So many of the people who were doing the testing on Fridays have formed a new Tiger team. The vans got delivered this week, and so they're ready to go. They're going to be especially targeting difficult to reach groups. So if you live in Tiller, if you live in Toketee, if you live in Riddle, if you live out in Elkton, these are places that are relatively far from other healthcare people, and they're going to be working on events in those areas to go ahead and deliver vaccine to groups. I think they're mostly going to be able to use the J&J vaccine, and the J&J vaccine it's a 1-dose vaccine, a very good vaccine, and they should be able to do that. It's a great little team of 6 that are going to go and do that. And so we're really excited about just another way for people to get vaccine. They will need volunteers. So when they set up an event, say in Toketee or whatever else, they're going to look for local volunteers to help them with some non-medical duties, maybe directing traffic, handing out donuts, whatever it is that they'll be doing. So you'll be hearing in the next week or so about requests for volunteers for these events. And there'll be events in your community, and that'll be great. So Colleen says, if you receive your first Pfizer dose at the fairgrounds on the 13th, when and where do you receive the second dose? Exactly the same time. So we were saying for people in my age group, same bat time, same bat channel. So you come at exactly the same time. You had a 10:30 appointment on March 13th. You come back on 10:30 on April the 3rd. If you can't remember when your appointment was, and people like me will forget when that would be, if you'll call to the number tomorrow. So on our announcement today, there was a number to call, or just call the hotline. They'll have a list of what your time is. We're not going to be strict with that. If you had 10:30 appointment and forget and get there at 11, we're not going to turn anybody away. We want them to get done. So Paul says, what medication should one avoid after the first and second dose of the vaccine? Normal medication's okay, but stay away from pain relievers. So let me tell you, the story is that pain relievers such as ibuprofen or aspirin work because they're anti-inflammatory drugs. So they tamp down your inflammatory response a little bit. Tylenol works on the inflammatory system in an unknown way, but it does. And so there is a theoretical reason not to take anti-inflammatories before you get the vaccine. because it could dampen your inflammatory response, which is the response that helps you make antibodies. And so there's a theoretical reason to do that. So as a pediatrician, we give a lot of vaccines. And people want sometimes to give their kids Tylenol, Motrin. So they've studied that, and they've seen in pediatric things that if you give kids Tylenol or Motrin, you have a slightly lower immune response than people who don't. The difference is statistically important, but clinically not important. You still get very good response, and we think the same with this. So if you don't need to take Motrin or Tylenol, don't. But if you're feeling crummy after you get the shot, please do. The other one is alcohol. Alcohol also diminishes your response, so don't drink heavily on the morning you're going to get your shot. That's okay. And probably don't take Tylenol or ibuprofen before. But if after you get the shot you're having some symptoms, perfectly fine to take some Tylenol or ibuprofen. So Nicole says, I had COVID a few weeks ago, pretty bad. Sorry. Now that I'm off steroids, my knees are in excruciating pain to the point I can't walk. What do I do? You really need to call your doctor. So what happens is when you're on steroids dampen your immune response. And sometimes if you stop them quickly, your pain will recur. So you definitely should talk to your doctor about whether they want to put you maybe on a tapering dose of steroids or something for that. So that's one of the things we're seeing is that people who get COVID will frequently have aches and pains that they've never kind of had before. So a couple of younger people who've had this say, I feel like I'm 100 years old. And so that's typical. So definitely talk to your doctor about whether they would want to put you on maybe a tapering dose of steroids. So Chelsea said, what percentage of people will test negative with the rapid but be positive on the PCR? This totally depends on whether you're symptomatic or asymptomatic. So let's suggest you would be symptomatic. So if you get exposed on the 1st of April, your PCR will start to get positive on the 3rd and 4th day and will remain positive on an average of 26 days. The rapid test will generally start to turn positive on the 4th or 5th day and then turn negative on the 8th or 9th day. So between the 4th and 9th day, both your PCR and your rapid tests are both likely to be positive. But if you get tested with both tests very early on, and we've seen a couple of these where people have symptoms, first day go in and get a test, their rapid test is negative, but the PCR that comes back a few days later is positive, done at the same time. And then we also see people who get tested with a PCR weeks or months sometimes after their infection, and they stay positive. So it depends upon which day. So test negative with the rapid, but be positive on the PCR. So on the 1st and 2nd day, both are going to be negative. 3rd or 4th day, the PCRs are usually positive and the rapids are usually negative. The 5th to 9th or 10th day, they're usually both positive. After the 9th or 10th day, the rapid test is likely to be negative and the PCR is likely to be positive. So it's very dependent upon timing. So how many more cases per day do we need to move to the low risk category and open more? Well, we're probably not going to get there now. So we would need to have under 112 cases in a 2-week period. And I think we're just about there now. So I don't think we're going to move to low risk, but I think we'll stay in this high risk for this time. But we're hoping in the next measurement period, which starts a week from, starts 5 days from now, that we might be able to get to one of the lower ranges. So Martin says, what's the take on Chile? They have relatively good vaccination percentage. Would you guess mainly the Brazilian variant? So variant analysis in South America is terrible. It's great in Europe. It's not very good in the US, but it's even more terrible in South America, where they're doing almost no variant analysis. So we really don't know about variants. I would assume, however, that the P1 variant, which they call the Brazilian variant, is pretty much dominant in much of South America. And again, let me talk about the vaccination percentage. So when we tend to vaccinate, we usually start with healthcare workers and people in nursing homes, and then move to people 80 and above, like we did in Oregon. Those are people who are generally not spreading the disease. So people in nursing homes are people getting the disease. Healthcare workers are people who may be exposed to the disease from their patients. And first responders, people who are exposed to people on the job, but they're generally not the people who are spreading it to lots of people. So although we may have 30% of the US population vaccinated, we only have a tiny fraction of the spreaders. Who are spreading this? Young people who are going to parties and going to spring break. Those are the people who are largely spreading the disease, and almost none of the spreaders have yet gotten vaccinated. So when we talk about 30% or 40% of the population being vaccinated, the question is what percent of the spreaders are getting vaccinated? And even in the US, it's very low. Again, remember that most of our spreaders are not the people in nursing homes. They're not old people. They're not healthcare workers. So I don't think the vaccination percentage yet makes a big difference in the amount of spread. And I think that's why we're seeing another wave here, because again, the people who are spreading this are not the people who are currently vaccinated. Now, I think the vaccination amount is going to clearly decrease the number of deaths in this spike, because I think the people who will get cases in this current one are going to be younger people who generally don't get that sick, don't get hospitalized. But we're already seeing an increased number of hospitalizations, so there is a worry. But I think the number of deaths will be down, because again, most of our deaths are in people who are 60 and above, certainly 75 and above, even more, and many of them have been. So I would predict that we might see a rise in the number of cases, but I think the number of deaths is going to be somewhat blunted. Eldon says, I'm allergic to penicillin. Is there a particular COVID shot that is best for me? So the best COVID shot is the one you can get. So there does not seem to be a big difference. Now, anaphylactic reactions, that kind of really overwhelming reaction, is seen a little less with the J&J than with the Moderna and the Pfizer vaccines, but the difference is small. So Annabelle says, are you seeing less colds and flus due to social distancing and mask wearing? Absolutely. So the colds and the flus that we see are very much decreased this year. So influenza is decreased by as much as 99% because of three things. One is more people got the flu vaccine this year worrying about what was going to be happening with the flu. Social distancing, mask wearing, and staying home when you're sick clearly decreases the spread. The other one is a virus called respiratory syncytial virus, so RSV, which really pediatricians hate, because RSV tends to go around every winter, really gets babies when they get it, so spreads among older kids who have colds, and then they bring it home to their baby brothers or sisters, and then these kids cough and wheeze, and they're just so miserable. They're just so miserable. And so RSV is something that pediatricians dread every year. This year, there have been very few cases of RSV, because both colds, RSV, and flu are much less contagious than COVID. So when you're social distancing and masking and staying home when you're sick, it prevents COVID a little bit, but it prevents these other things a lot. And that's why we've seen a real decrease in flu, RSV, and colds. And strep, I don't think I've seen a case of strep all winter. Maybe I've seen one, but really strep is so much less, because again, those things that we do to prevent COVID also prevent these other diseases. And these other diseases in comparison are wimpy. I mean, strep has got a reproductive number of less than 1. So you'll see the occasional case, but you almost never see a big outbreak of strep. You may see 5 cases in a week or something at a school, but it doesn't ever spread to everybody in the school like COVID does. You'll see RSV spread in a family, but it's never going to spread to an entire nursery like COVID does. So I'm glad that we're seeing less colds and flus, and maybe in the future, we'll talk about a future where we understand that and people, when they're sick, will stay home rather than spreading it to everybody else. So Brandy says, how do you sign up for Saturday? And so you can go to our website, you can go to our Facebook page, you can go to the county page, and there's a link on Eventbrite. So it's and I can remember, it's like https://eventbrite/e/something, and you click on that, and it takes 2 minutes to sign up. I think there are 7 questions. Fill in those 7 questions, pick a time you want to get it, and you got an appointment. When I checked, the appointments for the J&J, which were between 8 and 9:45, were filled, but there were still some Pfizer vaccine ones starting at 3 o'clock, so go for it. Yeah. Veronica says, I asked this question, why are doctors in the ER not testing when someone has symptoms? I don't know. Yeah, we hear this all the time, that people had symptoms and they didn't get tested. We have these tests. They're free, $0. They cost nothing. We give them to people. They're the Binax tests. They're very, very good for symptomatic people, especially if you've been symptomatic for 24 hours, per the previous discussion. And they're so easy to do. They really, just swab the front of the nose. They take 15 minutes. So I don't get it. I talk to people in the ER and docs all the time that if you think somebody might have COVID, just do the test. And if the test is negative, person should still stay home until they're feeling better. But these tests are so good, and I don't quite get it. But yeah, we've heard the same thing. So Haley says, can a nursing mom pass the benefits of the vaccine to a nursing child, or wait until there is more research? Well, there is now been some research where a mom who got this, they checked the baby's antibodies, and the baby had a lot of antibodies. So it does seem that the mom will pass the benefits to a nursing child. So the antibody system is complicated, but there's both the IgM antibodies, which are the first kind of antibodies your body make. Those do not get passed well to the baby. But then after a month or so, your mom starts making IgG antibodies, and those IgG antibodies do pass well to the baby. And we think that's going to work very well. So our recommendation would be for pregnant moms to get the vaccine. Certainly talk to your doctor, but we would say it. Okay, going to get a few more, while he's getting here, a few more questions. One is, the question is, does the vaccine prevent all infections or just symptomatic infections? So they did a study, and Portland was part of this study, where people swabbed their noses each week to see how well the vaccine worked, and the vaccine appeared to be about 90% effective. There were 2 other studies, one in Israel and one in the US, that showed that among healthcare workers, the vaccine is about 90% effective, that some people got the vaccine and some didn't. And when they looked to see, about 90% of the people who were getting the disease did not have the vaccine. So again, the vaccine seems to work to prevent deaths, almost 100%, hospitalizations, well over 90%, symptomatic infections, about 90%, and even asymptomatic infections, about 90%. So the data is just continuing to accumulate that the vaccines really, really, really work. So what's the barrier here to being done with this? And there will be no one happier than I to be done with this. I mean, it's been a draining year to get all of this stuff done, and it'll be great to be done with this. And the way to get done with this, I think, is to get enough of the people vaccinated so this disease goes so down in incidence that we can treat it as an annoyance, but not something which disrupts our lives. So we think that when you get down to 1 case per 100,000 per day, so that would be 1 or so cases a day in Douglas County, that you could pretty much get back to normal things. You could get rid of masks, you could get rid of distancing, you could get rid of all those things, and you would just deal with that 1 case per 100,000, and you'd still be careful about it, but it wouldn't be the huge fear that it is now. So how do you do that? Well, to do that, we're going to need to get enough people vaccinated and not have the variants take over. And to get enough people vaccinated, we're going to need to get a lot of the people vaccinated. Now, people talk about like a magic number for herd immunity. And I think that's a little misleading, because remember, as I said before, if you vaccinated all of the people in nursing homes and people who were masking and distancing, but didn't vaccinate any of the 20 to 35-year-olds who are the most active in society, you're not going to get it. So you're going to need to really get a wide group of people. Yet when we look, there are a number of people who say they're not going to get the vaccine. So I looked at some numbers today, and the numbers were that about 40% said yep, I'm getting it. 40% said, not sure, I'm going to wait a little while and see. And about 20% said, no way in hell am I going to get the vaccine. That's going to make it hard, right? Because there's already 20% of the people, children, who can't get the vaccine. And then so that you're starting already with a group of 100,000, say 112,000 Douglas County, that's already about 20,000 people who can't get the vaccine because they're children. So you're now down to about 100,000. If 20% of the people in our county say no, that's down to 80,000. Remember, the vaccine is only about 90% effective, so that would only be 72,000 would be immune if all of the people who are not sure decided to get it. So we're going to really need to convince people that this really is our way out. And I don't know. When we look at the groups, it appears that people who are whites are more likely to want the vaccine, lower in blacks, more in people who are liberal, less in people who identify as conservative, more acceptance in people who are urban and less acceptance in people who are rural. So we've got some work to do, I think, to convince people to get the vaccine. So that's the work we've got to do. So someone says, do symptoms come and go and change in COVID patients? One day cough and sinus, next day feeling drained and body aches? Absolutely. So COVID is one of the least homogeneous diseases we've ever seen. I mean, when I look at a disease like measles, and thank God I haven't seen it in a while, but when I did see measles, it's so typical. High fever and feeling crummy for a few days, then you break out in a rash, then you have Koplik spots, and so you've got this in a very predictable fashion. Almost no asymptomatic cases with measles, almost none of the funny symptoms that you get with this disease. This disease is so weird because some people are really asymptomatic, some people have only mild symptoms, some people have loss of taste, other people don't, some people have the cough and the sinus and next feeling drained and body aches, and then 3 days later they're better. So this disease is very variable, and because it is so variable, and because it is so variable, we're asking people to, if you have any of the symptoms that look like COVID, you should get tested. So in this week, we've seen people who I only had a sore throat. Remember, I said we've seen almost no strep this year. So if you've got a sore throat, you should get tested because that could be one of the symptoms of COVID. I didn't really feel sick. I didn't have fever, but I was just so tired. Again, another symptom of COVID. So if you have those symptoms, please stay home, except you should get tested. So Vicky says, last Tuesday you said we need to be under 150. So I talk fast and you may not have heard it. So the story is we need to be under 100 cases under 100 cases per 100,000 over 2 weeks. There's 112,000 people in Douglas County, so that would be under 112 cases for the 2 weeks. I think what I'd said was, I don't know how I said it, but we need to be under 112 to get down to the next range. So I think we're likely to be in the 100 to 200 range, the high range, for these coming 2 weeks. I don't think we're going to be back into the extreme. In fact, I would be really surprised. We'd have to have a really crappy few days to get that high. So Clarice says, I'm having my second shot on April 14th, so I'll be immune on May 1st. Will I then be reasonably safe to be with family and friends? And so remember, we never give the super definitely safe or definitely unsafe. So your chance that you'll be immune by May 1st is about, depending on which vaccine you got, so you're getting a second dose, so likely getting the Moderna or the Pfizer, that there's a 94% chance. So 94% chance that you'll be immune. That is great. So that's 19 times or 20 times better than if you hadn't gotten the vaccine. That's great. And if the people you're going to be with are also immune because they've gotten the vaccine, that decreases the risk further. So the recommendations, the current CDC recommendations for someone like you on May 1st, you'll have completed your series, are 3. One is you don't need to quarantine if you get exposed. The second is that it is safe to be around other immunized people or around low-risk unimmunized people. So other immunized people might be another couple that you go to dinner with. Unimmunized people, low-risk unimmunized people may be your otherwise well grandchildren. So that would be great. Now, would I totally throw caution to the wind? So I'm more than 2 weeks after my second dose. Would I fly? Not unless I absolutely needed to. Would I go on a bus trip? Not unless I absolutely had to. Would I go to a big party? No, because although my risk is only 5% of what it was before, it's not zero, and I really don't want to get this thing. So I would still wear my mask and avoid those things. But come May 1st, if your family and friends have otherwise been vaccinated, I think it's safe to do it, and I think the CDC would agree that it would be safe to be together. So great. So Michelle says my granddaughter's 30 years old and wants the shot. When is she going to be able to get it? So we think that people 16 to 44 are going to be eligible with underlying conditions, are going to be eligible on April the 5th, which is this coming Monday. And it's going to be eligible, and all adults will be eligible on or before May 1st. On the other hand, I will tell you, look, we're not going to be pimping people to find out what their underlying conditions are. So if you come this weekend and you're 48 and you say you've got an underlying condition, we're just going to give you the shot. So Veronica said is being dizzy to the point of not being able to walk and tired a symptom. Absolutely. So there are some people who report their very first symptom as just a dragging tiredness, like, oh my God, I couldn't believe how tired I was. I just slept the whole day through. So we have definitely seen that. Dizziness, another one. The other one we've seen is tinnitus, which is that ringing in the ears. And there was this guy who was a CEO from I think Texas Roadhouse, who committed suicide because the tinnitus that he got was so terrible. So again, a disease with so many manifestations. So we would worry about that. Okay, some more questions coming in, but we have a couple of other things here. So one of the deals is about long haulers and what happens when they get the vaccine. So again, these are people who call long COVID or long haulers. These are people who continue to have symptoms weeks or months after they had the disease. And the question was, what will happen when they get the vaccine? Will they have an additional immune response to the vaccine and get worse? Or will they not have any effect at all? Or will they get better? And the data is in. So among the long haulers, anecdotally, again, not a big study being done yet, but anecdotally, about 40% consider themselves to be significantly better with the vaccine. About 20% said they were slightly worse. Not very many said they were significantly worse, but about 20% they were slightly worse, but about 40% were significantly better with the vaccine. So if you're one of those people who had COVID and continues to have symptoms, I think the recommendation would be definitely to go ahead and get the vaccine. In terms of vaccine supply, we're told this week that there's going to be a lot of J&J next week. I'll tell you, this whole COVID story has told me that you have to take everything with a grain, let's say a big cube of salt, because over this time we've been promised tests that don't arrive, vaccines that don't arrive, and so we really only believe things at this point. We only believe things at this point when we actually see them, but we're told that there's going to be considerably more vaccine in the next bit. All right. Do you see significant changes to white blood cells, hemoglobin, iron trouble, and the need for iron and blood post-COVID? Actually not. So the one organ in the body that does not seem to be much affected by COVID is the blood system. So there tend to be slight changes in the lymphocyte count early on in this disease, but generally other kinds of changes in the blood count we do not see. So we're not seeing lots of significant changes. Now, people who get hospitalized with this and have a lot of blood drawn and whatever, they can get anemic just because they've drawn so much blood for studies. But generally, if you had to think of the one system in the body that was least affected by COVID, it's probably the bone system, where we've not seen a lot of changes, and the blood system. All the other systems of the body really are affected. So there's lots of different skin changes. There's changes in liver function tests. There's changes in kidney function. There's clearly changes in heart, lung, and brain function. But the blood system, less affected, and the bones, less affected. All right, we have a couple of other things here. So one of the questions that came up was about the AstraZeneca vaccine. And the AstraZeneca vaccine has really been a troubled vaccine. So the AstraZeneca vaccine, which is made by AstraZeneca and the University of Oxford, is a chimp adenovirus. It's an inactivated virus that doesn't grow in your system, but does get into your cells and then tells your cells to make the spike protein. Your body then makes an immune reaction against the spike protein, and it works. And it does seem that the vaccine works, but their trials were troubled. So they did their trials and they had a hard time getting people back at the right time. They had a dosing miscalculation for part of it. And then they had some safety issues early on that were not well disclosed. So it's always been a little bit problematic. Anyway, it's been approved for and used in Europe. And they are seeing, in rare cases, about 1 in a million, they're seeing cases where people, mostly young women, so these are mostly people less than 60, many more women than men, have a funny clotting issue where they have clotting in the veins to their brain. So your brain has arteries that bring blood to it, veins that bring it back, and it seems to be clotting in the veins from the brain. Now this is something you'd occasionally see before, but actually does seem to be 1 in a million in the people get the vaccine, and 1 in 5 million of people didn't get the vaccine. So slightly more common in the people who got the vaccine. Still not very common at all, 1 in a million, but enough to make people a little leery of this vaccine. It's going to go for U.S. approval in April, and I'm not sure what's going to happen. It's hard for me to believe that they'll sell much of this in the U.S. because if you already have the Moderna, the Pfizer, and the J&J that don't have this side effect, and they've looked carefully for it, that don't have this side effect, and there seems to be plenty of those vaccines, why you would choose an AstraZeneca vaccine that could have that 1 in a million chance. But we'll see what the FDA does when they get that approval. All right, we're getting here to the end of time. We have time for one more question if somebody wants to write in a question. Let me again tell people how to sign up for this weekend's event. So there are again 2 big events. There's one for North County residents in Drain at the Drain Civic Center. If you've not been up there, it is a lovely building. It is one of the loveliest buildings in Douglas County. Beautifully built, nice and airy, and looks out over the covered bridge. So it really is a lovely place. They're going to be doing, Aviva's going to be doing it this Thursday, April the 1st, not an April Fool's joke, from 8 to 11:30 in the morning, and then in the afternoon from 1 o'clock until they're done. And the number to sign up for that one is 541-672-9596. I am not sure which vaccine they're going to use, but they're going to do that there on the 1st. And then on the 3rd, there's going to be one at the fairgrounds. We're going to be using the J&J vaccine. All of that's sold out, but we're going to have lots of Pfizer vaccine, and then take a look. So I'm here. Some people are concerned because there are Spanish instructions on the site. Well, the Spanish instructions are an exact literal translation of the English instructions. So if you read Spanish better, do the Spanish. If you read the English better, do the English. Don't get surprised. Just choose select a time, and then you'll get through that. So the Spanish thing doesn't say anything nefarious. They're just the recommendations in Spanish. What we've noticed is that the Hispanic population in Oregon is getting vaccinated at a considerably lower rate than we would expect. And so we want to be sure that those in our community who prefer Spanish as their language can actually do it. So again, if you want to do it, if you get on our website, if you get it on our Facebook page, or if you get it on the county Facebook or website, you can find it. It'll start with Eventbrite and then has a long number that is 148, and click on that. And I did it for a few people today who called in and were having trouble, didn't have internet. I got them going, and it took about 2 minutes, and I typed slow. So if you type your own name faster than I can type my like that, you'll even be less than 2 minutes, and you'll be able to get an appointment. Again, it should be a great time. The weather's supposed to be okay this weekend, so we're excited to do it. We're going to do it again in another 3 weeks, because in another 3 weeks, the people got their first dose of Pfizer vaccine this week will go for 3 weeks, will need their second shot. And then again, we're going to do the Tiger Team. So if you have an area that you think the Tiger Team would benefit, please let us know. As I said, we're now planning to do places like Toketee and Tiller, Dace Creek, down in Brittle, Elkton, maybe Curtin, to do some of the farms, to do some of the shelters. That'd be great. Yeah. So someone says, I took my son to the dentist today, and the dentist walked in the room without a mask on. He put it on while in the room. My son wasn't wearing a mask because he was having his mouth looked at. The dentist was less than 6 feet away from my son without a mask for about 15 seconds. So should I be worried? No, that kind of exposure is going to be a low risk exposure. Hopefully the dentist is immunized, so his chance of having the disease is really, really, really quite low. And typically we think a significant contact is less than 6 feet for 15 minutes, not 15 seconds. So I think you should be okay. Again, we don't think we've seen any passage of the disease at dentist's office. The dentists in general have been incredibly, incredibly careful about COVID. I mean, if they got COVID, their business would be shut for weeks at a time, and that would be disastrous for them. So if any group in town has been careful about this, it has been the dentists. So anything back on the genetic testing from February that we want to check for variants, we have a few of the test results back, and they're not variants. And so the only variant that we know of is still that P1 Brazilian variant from late January. However, I'll tell you that the slowness in getting these tests back from the CDC is absolutely maddening. And if you want to hear a rant about that, go to last Friday's, because that is just so annoying. The good news is that Oregon decided not to work with the CDC. Well, we're still going to work with the CDC, but not to rely on the CDC for variant analysis. So Oregon bought all the equipment to do it, and starting yesterday actually, Oregon is going to start doing the variant testing. So they promised a turnaround time of 1 week, which is great. Really the time you need. Doing it faster than 1 week is hard. They're going to get it back to us in a week. And so we're very pleased that Oregon is doing that. So the good news is still no news on variants. The bad news is that they don't tell you when they don't find a variant. So they do tell you when they do find a variant, but they don't tell you when they don't find it. And that's maddening. The state, when Oregon does it, they're going to tell you both if they find it and then if they don't, which is really what we need to know. So when we hear that we haven't found any new variants from the CDC, that doesn't mean that the ones we sent weren't variants. It means they're either not done yet or there are no variants. That for me is not useful. So I really hate it when people say, oh, we'll call you if there's problems. And the answer is, well, you didn't call me, and you didn't call me because there weren't problems, or you didn't call me because you forgot. And so this will be so much better doing it through the state, because they're going to tell us both ways. All right, that looks like it for the questions, and it's just 6:50, so it's time for us to go. Again, Dr. Bob Dannenhoffer, the Public Health Officer. I want to remind people that the best way out of this is going to be vaccine. Good news is we're getting more and more vaccine. We have so many people who are giving vaccine, and we have so many more places to get the vaccine. Almost all the practices in town get vaccine. They got some today. Many of the pharmacies are getting it. They're getting it either through the federal pharmacy partnership or for us. And then we've got the big events, the Drain Civic Center on the 1st from 8 till 11:30 in the morning or 1 o'clock on. And to sign up for that one, it's 541-672-9596. The other one is the 3rd, which is on Saturday. It's going to be at the fairgrounds. To sign up for that, go on any of the websites, and you'll be able to find the Eventbrite link and click on that Eventbrite link. 2 minutes to sign up, and you'll have an appointment for the vaccine. Again, this weekend, this time we're doing people 45 to 64 with underlying conditions, but we're not going to be hawks on this. If you're 45 to 64 and think you have an underlying condition, please come. We're also going to do people who are in congregate settings, people who have been displaced by the wildfires, people who work in food service. So as long as it's open, please come and get vaccine. And then our Tiger team, which is going to go out to these various places around the county and do those places that don't have access to vaccine. So if you think you know a place that faces a barrier and it would be good for the Tiger team to visit, let us know and we'll pass it on to our Tiger team. Again, people have been incredibly nice. I cannot tell you how many people I run into at the supermarket or run into when I just around town who've been incredibly thankful for all the great work that's been done by public health and by the county. And I will tell you, our county, we struggle sometimes. I mean, our county's older, or our county is less rich than other places. Our county is not in the middle of things, but I will tell you for this, I think we've done about as well as anyone in the country, and I'm so proud of everybody in Douglas County. So again, as I always start, be safe and be kind, and we'll do this again on Friday. And we'll do it live on Friday, so you get a chance to answer your questions. Again, if you have questions before then, Facebook questions at douglaspublichealthnetwork.org, and your questions will go first. Again, be safe, be kind. Thanks.